Chapter 14, Providing Employee Benefits. LOs discuss the importance of benefits as part of employee compensation, summarize the types of employee benefits required by law, describe the most common forms, paid leave, identify the kinds of insurance benefits offered by employers, define the types of retirement plans offered by employers, describe how organizations use other benefits to match employee wants, needs, explain how to choose the contents of an employee benefits package, summarize the regulations affecting how employers design administrative benefit programs, discuss the importance of effectively communicating the nature and value of employee benefits. Employee benefits. So when we look at employee benefits, we talk about compensation to employees in forms other than money. So everybody's looking at the salary and you think about that, but there's other things you got to look at too. And these other things often, particularly as people get older and you get married, you have children, and you start getting close to retirement, you're thinking about your future, you really look at packages, benefit packages. That's often how it's referred to. And certain benefits are required by law. The creative benefits package makes companies competitive. But this is how you attract and retain people and how you get people to come to your organization. Give you an example. Why would somebody leave one job, go to another job and make less money? It might be for something in the benefit package. That's why. So benefits as a percentage of total compensation. So when you look at it, in 1955, it was 14.5%. And now you look at it, it is at its peak in 2017. And now it's down to 2022, you see 29.5. But you see this is this is something that's going to always be very important compensation package for various people. And everybody's going to be different based upon what's going on in your lifestyle, how you live, what your family needs or your personal needs are. It's going to determine the type of benefits that you value the most. So benefits are some benefits required by law. So we look at benefit, we look at employer requirement. Social Security, flat payroll tax on employees and employers. Unemployment insurance, payroll tax on employers that depends on the state requirements and experience rating. Workers' compensation insurance provides coverage according to state requirements, premiums based on experience rating. Family and medical leave, up to 12 weeks unpaid leave for various things. Healthcare, provide employers with at least 50 employees payment of a fee to the federal government if the employer does not meet these conditions, providing health insurance. So when you look at that, these are the ones that's required by law. And then you got federal law involved in here, you got state law. And it's in particularly when you're 50 employees and over, that changes a lot of things. Now, if you're an employer and you just got 10 employees or a couple employees, less than 10, you still have to abide by a certain amount of these requirements. Employers and employees share costs through payroll tax benefits and the OASSD program, Social Security. So you have retirement insurance, unemployment insurance, survivors. So retirement insurance, you see old age, this is insurance that's going to be important to people when they get to the point where they start to think about how do they live for the rest of their life. Do they have enough retirement coming in? Unemployment insurance kicks in when people lose their jobs, when other than them quitting through no fault of their own, they're entitled to be paid a certain percentage of money for usually up to about 12 weeks. Disability insurance. This is insurance where people pay into it. So in the event they become disabled, something happens to them at work. Hospital insurance. This is called Medicare Part A, and then you got medical insurance, Medicare Part B. So these are the types of things you look at where some people refer to as health insurance, and then when you retire, you get to the point where you're talking about actually drawing Medicaid instead of actually having benefits at age 62. The benefits depend on a person's age and earnings history. So if you have somebody who's two people the same age, but one person over the course of their life earned $2 million, and the other person over the course of their life only earned about $900,000, their benefits won't be the same because the other person made more money, they paid more into it, and they'll be receiving more benefits in retirement. Employment insurance. So this is federally mandated program administered by states. Minimizes unemployment hardship, provides payments to offset lost income, helps unemployed workers find new jobs, gives employers incentive to stabilize employment, preserves investments in workers' skills. Most funding comes from taxes on employers. So this is something, again, when people lose their job to no fault of their own. Let's say that they get laid off or it's downsized or the company goes out of business. That's when someone could qualify for unemployment insurance. To receive unemployment benefits, workers must meet 4 conditions. Can demonstrate they were employed, be able to work, be actively seeking work, and not discharged for cause. Basically, you can't be fired for any reason. And when you are drawing this, it's not like you get to go home. It's not like you're going to make the money you were making when you were working. No, I can give you an example. One lady, she was making $2,600 every 2 weeks, and she was laid off from her job. Well, in unemployment, she was drawing $600 a week. So you see, it's not going to be anywhere near, but it's supposed to be something just to help you out. And one of the things too, to get it and maintain it, you have to provide proof that you're actively looking for work. Workers' compensation. State employees that provide benefits to workers who suffer work-related injuries and illness or to their survivors operate under the principle of no-fault liability. The employee does not need to show the employer was gross negligent in order to receive compensation. Employers protected from lawsuits. Generally, 2/3 of workers' earnings and tax-free. So you can see when someone's injured on the job, if they're out there working, they're injured on the job, legitimately doing the job, not doing anything crazy, not driving equipment under the influence or whatever. It's an accident, they get injured. That's where this kicks in. And you see, again, it's not usually something that's going to replace your income, but it's going to be close to it when you talk about 2/3. So it falls into 4 major categories: disability income, medical care, death benefits, rehabilitative benefits. So when you think in terms of workers' compensation, are we paying disability? For instance, what if somebody becomes disabled and they're disabled for life? What if somebody, gets injured, but they require medical care, but they recover? Some people, they're accidentally killed at work, death benefits. And some people get injured and they have to have rehabilitative benefits. This is what it will cover. Cost is influenced by the kind of occupation involved, state where company is located, employers' experience rating. Employers purchase the insurance and pay the premiums. So when you have employers, the employers have to pay things that employees don't, and this is one of them. Family Medical Leave Act. So organizations with 50 more employees must provide up to 12 weeks of unpaid leave for these things: childbirth, adoption, to care for a seriously ill family member, or for an employee's own serious illness. Now, when they say a seriously ill family member, they're not talking about boyfriends and girlfriends and babies' mamas and babies' daddies. They're talking about spouse, child, or parent. Same comparable job guaranteed upon employee's return. So when they come back, they get their job back. You can't say, well, you were gone for 12 weeks, now we're going to give you a lesser job with lesser pay. Must comply with the Pregnancy Discrimination Act, which basically says you can't discriminate against women for being pregnant. Patient Protection and Affordable Care Act. So employers are not required by law to provide health insurance benefits. Those who choose not to must pay a penalty. Choice depends on number of full-time employees. Reporting requirements on employees' W-2. Small businesses can buy insurance from a shop. Laws are complex. HR professionals must continue to educate themselves on these requirements. So this is something that is you look at, and it is very complex. It can get very complex when it comes to benefits, particularly with this stuff right here. And this is why you have people who specialize in that in HR and to handle these types of things. And you find small businesses they can buy from like a shop. Basically, they can buy insurance through companies and stuff where it's almost like multiple companies come together or buy insurance from places, from businesses and stuff, and they're able to get it at cheaper rates because it's almost like they bought it like a group or something. Percentage of full-time workers with access to selected benefit plans. So let's look at this. So you see the highest is going to be paid holidays, paid vacation. Then you see next after that is Medicare. You see sick leave is right up there. Life insurance is probably least, and then you see retirement plans. So what you find with a lot of companies now, they don't have retirement pensions anymore. Meaning, I work 20, 30 years here, and then I retire, and I get a monthly income for the rest of my life because I worked there. What they do now is they have retirement plans that's like 401ks, which is like based upon how much money do you contribute. If you contribute 5%, the company will match it. Optional benefits, various kinds of insurance, retirement plans, and paid leave. Benefits such as health insurance may extend to employees' dependents. Often includes domestic partners. Since 2015, Supreme Court ruling on same-sex marriage trend is towards benefits for spouses regardless of gender. So a lot of times you find some people who they're the breadwinner. They may not be in a traditional marriage or whatever else, but they may have a spouse or significant other that pretty much just like having a spouse. And so now these people can get benefits through their job, and they can also provide benefits for their loved ones. Paid leave, major categories: vacations, holidays, and sick leave. Must also account for other situations like injury and military leave. Optional paid leave for things like voting and donating blood. There is no legal requirement for paid leave in the U.S. Average paid leave in the U.S. after 5 years, 15 vacation days and 10 paid holidays. Sick leave days accumulate with length of service. Optional are personal days, floating holidays, and paid time off. So when it comes to this, you are going to find in most businesses they will have paid leave. Why? Because if they didn't, they wouldn't be able to hire anybody because everybody else is. With the exception of maybe really small businesses, mom and pop type operations, this is something that is going to be pretty standard in the U.S. Now, if you go into other industrialized countries in the West, you find a lot of times that they give more leave than they do in the U.S. Which optional benefits program is most important to you? So as you see, you can look at them. You can pause this and take a look and see which one is most important to you and why. Remember, I said everybody's different. Usually what's most important to you is based on your circumstances, to include your age, where you are in life, and how close you are to retirement. Do you have a spouse? Do you have children? Paid time off is a way for employees to enjoy time with their families and to refresh their bodies and spirits. Is paid time off an important factor for you when accepting a position? Ask yourself that question. I do know it is for me and most other people. Optional benefit programs, group insurance. So you have medical insurance. 70% of all full-time employees in the U.S. receive medical benefits. Hospital expenses, surgical expenses, and visits to physicians. Consolidated Omnibus Act, Budget Reconciliation Act of 1985. The acronym is COBRA. Employers required to allow employees to extend health insurance coverage at group rates up to 36 months after layoff, reduction in hours, or employee's death, and that's for the dependents. So you can see one of the things that is very important is providing medical insurance, and we have a law that also says that if you lay somebody off, and let's say that they're the breadwinner in their family, and the husband works, the wife doesn't work, she stays home and she raises the children. Well, when you lay him off, does that mean he's going to be without health insurance and that whole family? No, because for 36 months they can do COBRA. Employer approaches to controlling health costs. Managed care. The insurer plays a role in decisions about health care, avoiding unnecessary procedures. So this is when they're actually getting the managed care. They can say, okay, that's an unnecessary procedure somebody's having. We're not going to pay for it. Health maintenance organizations. HMOs requires patients to receive their medical care from HMO healthcare professional. And what that means is HMO is a company signs up with a healthcare program with the HMO. Well, everything you do, you must go to the health HMO for them to agree with what you want. And if they have to send you to a specialist, then they'll refer you to a specialist. You can't just go to one on your own. Preferred provider organizations, PPOs, contracts with healthcare providers to provide services at reduced fee. And that's what I belong to, and it's called Blue Cross Blue Shield. So I can go to a network of people. They call them within network and outside of network. And if it's within network, then they'll provide services at a reduced rate. If it's outside of network, it costs more, but a lot of times some of that's going to come out of your pocket because they won't pay for that. Flexible spending accounts. Employees can set aside a portion of the pre-tax earnings to pay for eligible expenses. So this is where you can go through your employer and say, okay, I have a wife who has diabetes, so we know that she has to have a certain amount of medical care and medication each month. So you can set aside pre-tax money into a special account to use that to pay for that. And that's pre-tax money to pay for your wife's expenses, which you know what they're going to be pretty much every year. Employer approaches to controlling health costs. So high deductible health plans typically brings together insurance with high deductible and a medical savings account with a specified limit of $38.50 in 2023 that the employer contributes to as payroll deduction. So this is where you have to have a high deductible, where you have to go in there and, before they pay certain things, you have to meet the deductible, which in this case is $38.50. Accountable care organizations, ACOs, a network of healthcare providers that practice value-based care. They agree to be paid based on results. Now, this is something that is out there. I've never seen it before. Employee wellness programs. This is something that's really big. Communications activities, facilities designed to change health-related behaviors in ways that reduce health risks. And what you find with these is like you say, okay, employer might say, for everybody who comes in and they're overweight, if they're willing to get involved in this program, this company-sponsored program, and they lose so much weight, then we will reward them in some capacity, in some way. Healthcare costs in various countries. So you see, the United States is the highest. The United States is the highest, and you see Germany's next to us. And you look at these other places and stuff, you wonder, why is that the case and stuff? A lot of that has to do with United States have a lot of pharmaceutical medical companies here. They do R&D and stuff, and some of these cheaper medications that's going to other places, Americans are paying for it. So plain and simple. Many people feel like we're overpaying, but we definitely pay the most. Life insurance. Employers may provide life insurance or offer opportunity to buy coverage at low group rates. Term life insurance. Employee dies during the term of the policy. Beneficiaries receive a death benefit payment. Optional benefits for accidental death and dismemberment. So most employers will offer life insurance, and while people are there, they can engage in this, and it's low cost. And if you leave that company and try to go somewhere else, and just say you try to go get a policy on your own, you may see how much more it may cost you. A term life is just something that says basically, this is not forever. This is for a designated amount of term, usually for the term of your employment. And when your death benefits and stuff, these goes to your significant others, like spouse or children, whoever you designated to go to. And dismemberment means if somebody actually loses a limb, an arm, a leg, an eye, something along those lines. But there's policies for that as well. And again, the wellness programs. You see, this is something right here that the insurance companies do that. And the reason companies engage in wellness programs, they feel like if we can get people to improve their health, eat better, and live better, we will have to pay less money in health insurance and medical expenses. Disability insurance, the short-term disability insurance. Percentage of employee salary paid as benefits for 6 months. So when somebody purchases the short-term benefits, disability, that means if they get hurt, sick, or whatever else, and this thing will kick in and pay their salary for 6 months. Long-term disability insurance, percentage of employee salary paid as benefits after the initial period and potentially for the rest of their life. And that's one of the things that you've seen growing more and more here in recent years as people purchasing long-term disability insurance so that they can't outlive their money. Long-term care insurance is something else that's popping up. Benefits toward the cost of long-term care and related medical expenses. So if someone gets elderly and they're no longer able, or elderly and sickly, or they're no longer able to stay at home, then they may go into a long-term care facility. Now you can buy insurance to help pay that. Sources of income for a person 65 and older. So when you look at that, you see, here's what a lot of people have. They'll have Social Security, they will have pensions and annuity, they will have earnings, investments, and maybe some other. So it's actually, so if you look at the pie here, there's different slices of the pie, and that's ultimately what people do in retirement. When people have struggle in retirement and over age 65, this is why they only have Social Security. They don't have the other things. Retirement plans, contributory plan, funded by employer and employee. So this is the plan where you have a retirement plan where the employer says, hey, if you're willing to put 3% in, we will match it. Non-contributory plan, funded entirely by the employer. They will put 3% in for you, but you can't match it. Defined benefit plan, guaranteed specified level of retirement income. So you pay into this plan, and it's guaranteed to give you a certain amount of money at retirement. Meets requirements of Employees Retirement Income Security Act, and aided by the Pension Benefit Guaranty Corporation. So again, the government steps in and also says that these things have to be in compliance with government regulation and stuff. Otherwise, you could possibly have folks out there who are telling folks that you have a retirement plan, pay into it, and take their money. Defined contribution plan. Employer sets up an account for each employee. Specific sizes of contribution into the account. So money purchase plan, profit sharing, employee stock options, section 401k plans. And this is what you'll find is very, very common these days, and is referred to as corporate America's 401k, and in non-profit or private, some places for 403b. Cash balance plan. Employer set up an account for each employee and contributes a percentage of employee salary. So the employees put money in there, consistent every paycheck. Value of retirement savings invested at different ages. So you see, if it starts at 21 to 29, ages when $3,000 is saved annually. So this is $3,000 saved annually. If you do that, you start at 29. When you reach a certain retirement age, you'll see how much that is. If you start later, you see how much it is. The key to it is to start early. And the reason it accumulates so much is because of compound interest. So if you start saving between 21 to 29, and you're looking at $3,000 a year, at 65, you got $450,000. Optional benefit plan. Government requires for vesting and communication. Vesting rights. When employees become participants in pension plans and work a specific number of years, they are guaranteed to receive a pension at retirement regardless of whether they remain with the employer. So what that means is this: if you work for a company and let's say that you work there a minimum of 3 years, then you become vested. And realistically, it's probably going to be like in corporate America. It's probably going to be more like if you've worked there at least 10 years, then you're guaranteed to get something in retirement. Summary plan description. The report that describes pensions plan, funding, eligibility, requirements, risk, and other details. Individual benefit statement describes employees' vested and unvested benefits. So this is something that explains things to folks, letting people know so they can make informed decisions. This summary plan description. And some people may decide, you know what, well, this particular plan right here might be too risky. Let me go with something more conservative. And the reason they can do that is because they're looking at this. Polling question. Jakar does not know a lot about investing and wants to ensure he has some retirement income when he retires. Agnes plans on changing employers every few years and is interested in investing her own money. Which plan would be best for Jakar and Agnes respectively? What do you think? Your answer is A. Family friendly benefits. So family leave. Federal law requires 12 weeks of unpaid leave. Child care, college savings. So when you look at this, these 12 weeks can be for any number of things when you're taking care of a family. Sick child, a sick mother, sick spouse, father, something along those lines. Then you have some organizations offers child care incentives or benefits that might pay you so much toward child care, or may have a child care facility in the building. It's the college savings. And when you talk about the college savings, one that comes up down is the 529 savings plans. It's where you put money away for children to go to college. Now, if they don't go to college, it also has some flexibility in there where they can still access the funds, but it's the way to accumulate tax-free savings to help them go to school. And also take care of the elderly. That 12 weeks can be used for that. Optional benefit plans. Subsidized cafeterias, on-site health care services, moving and relocating expenses, employee discounts, tuition reimbursement, recreation. So you see these things when you look at the big companies, and when they're trying to keep people, these are the kind of things that they do. And they'll come up with things like a relaxed work environment, and places where people can go and work out on their lunch, all these things. And once you get up into corporate America, one of the things that happens a lot to people too is as they start to advance in careers, they move, they get relocated. Well, now they have opportunity to move and have relocation expenses paid by the company. The organization's objectives. Decisions about benefits should take into account organization's goals, objectives, and budget, expectations of current employees and prospective recruits. So organizations that do not offer expected benefits will have difficulty attracting and keep employees. If a major organization out here now is not offering the basic things, there's no way for them to be competitive. I mean, really. And I'm gonna tell you what they would end up having is probably maybe hiring a bunch of folks straight out of college, but as soon as they get a couple of years experience, they will leave. Because some of the things that start happening to them, they will start getting married, they will start having kids. Well, if they're working for some place that pays them good but has no benefits, they're not going to stay. Employees' expectations and values. Employees expect to receive benefits that are legally required and widely available. Bureau of Labor Statistics is a good resource for benefits data. They value benefits that are likely to use. Value differs from one person to another. Benefits aid recruiting efforts. This is some of the stuff that as a recruiter, a good recruiter, when they're out there trying to recruit folks, they know their benefits. Their benefits are published on their websites, and they're published in brochures and stuff. And this is something that's going to be very important, and it would help attract certain types of talent. Selected employee benefits. Organizations can offer flexible benefit plans in place of a single benefits package for all employees, addresses differences in employees' needs, empowers employees, cafeteria style plan. Employees can choose the types of amounts of benefits they want from a set of alternatives. So when you look at this, it's like having multiple type of benefits, and people get to select what they want. But it's vast enough that it's going to have it'll satisfy different needs for people, and it empowers employees to the point where they feel like I can provide for myself and my family and my future and my family's future. Benefits costs. Approaches to saving money. Shift from traditional health insurance to PPOs and the HMOs type things. Shift more of the cost to employees, exclude or limit coverage to certain types of claims. So one of the things people looked at and said, benefits that we're offering and stuff is kind of getting out of hand. So what we're going to try to do is find ways to try to scale it back a little bit. So that's when they come up with certain types of plans, such as, these are the type of health insurances we're going to offer because that's cheaper, and you're going to pay more to go to the doctor. And we're going to pay less, and we're going to put a limit on the certain types of things that we're willing to do. Tax treatment for benefits. Qualified plans. offer more favorable tax treatment of benefits. Employees may immediately take tax deduction on contributions to plans. No immediate tax on employee for amount of employee contributions. Tax-free earnings on money in retirement fund. And plan must meet certain requirements to be qualified. So this is how people use these qualified plans, where they put money aside or away into a company-sponsored program to be able to take care and provide for medical treatments. Anti-discrimination laws. Intended to provide equal employment opportunity without regard to race, sex, creed, disability, several other things. So pregnancy discrimination. So this is a law that was passed that basically said that, you can't fire a woman because she got pregnant. And guess what? It was happening. Well, you're pregnant, so we got to get somebody else, and they would let go. No, can't do that anymore. Age discrimination. So you also had some employers that said, you know what? When you've gotten old, and we're going to get rid of you. Well, but the person could still do the job. And I can tell you why a lot of that happened back in the day. It was because that person had been there a long time and they were paying them a good salary. So what the company said, well, let's get a younger person so we can pay them less. So now they're protected. Older Workers Benefit Protection Act of 1990, which also comes into that as well, about benefits being offered for older people and stuff. You can't treat them different than you treat others. Americans with Disabilities Act. So you have some people who have things like autism and stuff. They can work if you give them an opportunity to. You just got to be prepared to do it. Accounting requirements. Financial Accounting Standards Board sets requirements for companies' financial statements, ensures that statements are true picture of financial status. Employers must set aside funds they expect to need for benefits to be paid after retirement. Statement must list funds for retirement as future cost obligations. So what these companies are obligated to do is basically when they say that they're going to have money for retirement and people have earned retirement or whatever, this is the law right here that makes sure that they do that. So if they say that money's going to be there set aside, they have to make sure and verify that they do have it, and it's going to be there for today and into the future. So communication is essential. So employees must be given information about benefits. Benefits are necessary to attract, motivate, and retain talent. It is difficult for employees and applicants to understand the value of benefits, so companies must help. Employers can use a variety of media to communicate. If an organization or company out here is trying to attract decent people, one of the things they must have is a decent benefits package. Again, most people are going to look at that to try to determine, is this an organization I want to work for? Now, I can tell you when somebody might be inclined to work for an organization that pays good money but has very bad benefits. It's because they're married to somebody who actually works for a company that has very good benefits. So they're covered by their spouse. So that's not uncommon to see that. Where one person says, my benefits are so good, you don't need them where you work. Just find something you want to work or earn straight money or work as a contractor or whatever else, but you have benefits. But if you're trying to attract somebody who's the breadwinner or they're single, you must have decent benefits. That concludes this chapter.